a person came to me and he was looking really miserable. He was contemplating suicide seriously. It is a very specific type of MRI to stop the medicines which causes changes in the personality. It causes changes in the brain structure. The entire life starts revolving around this pain. People do not know initially that this is trigeminal neuralgia. If you imagine an electrical cable, the wires will touch each other and there will be spark. Burn the nerve to numb it. Is that trigeminal neuralgia treatment is not only about treating the pain. It is about preventing the future cascade, microvascular decompression surgery with the aim of curing.
Team has so far performed more than 2,000 plus surgeries for trigeminal neuralgia. Hello and welcome to today's podcast. Today we have with us the world famous Dr. Jaydev Panchwag back on our show. Sir, welcome to today's show.
Very glad to be here. Hello.
It's so nice, and the overwhelming response from people that we had to call you again. And this time we are going to discuss about trigeminal neuralgia.
Happy to be with you.
And I believe this topic is something very close to your heart.
Yes, it is.
So how close is this to you, and how do you relate yourself to this?
See, trigeminal neuralgia pain
Is
also called as suicide disease.
pain. Yeah.
It's called as suicide disease.
I mean, is it that bad?
So that is how bad it is.
Oh.
People who suffer from this pain, they are literally tormented, and that's why it is very close to our heart. And of course, there were certain instances which made us focus on this more.
Okay. So, sir, this trigeminal neuralgia, as you call it as, suicide disease, does this always have this sharp shooting pain on one side of the face is what we know, right? But are there any predisposing factors, or are there any symptoms which comes before this, or is it something like you wake up one day and then you have a terrible pain? How is it?
Usually trigeminal neuralgia starts suddenly.
Acha.
I mean, one day person doesn't have pain, and the next day person will have this pain.
Achha.
So it starts suddenly.
Okay.
Initially, the intensity may be less, but over the period of time, it goes on increasing. And so to say, the disease establishes itself in the person's life. But when it starts suddenly. The classical features of trigeminal neuralgia are, like this. The pain comes like current,
Achha.
sharp shooting,
Achha.
only on one side of the face. There has to be a trigger factor like touching, even light touch or wind blowing against the cheek, or when you are cleaning your face, the towel brushing against the cheek or the upper lip or the lower lip, this part of the nose. See, any part on the face, on one side of the face, left or right, the pain is, as I said, only on one half of the face.
Correct.
It is not simultaneously. It is not simultaneously on both the sides of the face.
Okay.
It is on one half of the face. Okay. Any point on the face can be a trigger point, including the gums, one half of the tongue, and teeth can be trigger point. But there are certain very, typical trigger points in trigeminal neuralgia.
Okay.
Which are they? First is this part of the nose,
Achha.
then upper lip, then angle of the eye or lower eyelid,
Achha.
or forehead here, or this part of the ear, what we call as tragus.
Yes.
See this part.
Yeah, this section.
This
right?
section.
Yeah.
So these are very typical trigger points. Or
Achha.
teeth, while person is brushing or eating food, brushing against that part of gum or tooth, it can suddenly incite a pain. The patient is pain-free at one moment.
Achha.
He starts brushing his teeth and suddenly there is a pain. He stands or sits like this and the pain remains there for a few seconds and then it goes away.
So this is also probably very often, confused with other facial pain, dental pain.
It could be
the wisdom
confused.
tooth, because wisdom tooth pain also has a sharp shooting kind of a pain.
No, it
So
is
how-
not.
how
It is
does it
not.
differ?
See, the pain of tooth origin usually is a throbbing pain.
Okay.
It is continuous. It doesn't come in episodes of few seconds. If you get tooth pain, then you have pain the whole day. It is throbbing pain. It can reduce for some time, increase for some time, but the pain is always there. So typical trigeminal neuralgia pain, typical attack, in that you will have no pain in between the attacks. Okay. So this is a very specific point in trigeminal neuralgia.
Mhm.
Of course, as any pain syndrome in the
Mhm.
body, there is
Mhm.
a spectrum.
Mhm.
So I'm telling you the trigeminal neuralgia pain in its classical form.
Okay.
You can also have less classical presentations, what we call as atypical trigeminal neuralgia,
So these are
or
different types of
or
trigeminal
a
neuralgia.
typical trigeminal neuralgia getting converted into atypical trigeminal neuralgia.
Okay.
So it's a spectrum.
Acha.
But usually, if you go in the history,
Mhm.
it always starts in a very typical fashion. And then it can progress to different forms. It can evolve into different forms.
Mhm.
That is why history is so important.
Mhm. So, sir, that's what I was trying to understand. So, there are different types of is there any classification of trigeminal neuralgia?
No, there's a gross classification which is called as typical and atypical.
Acha.
In atypical trigeminal neuralgia, which we see in our clinic as an evolution of typical trigeminal neuralgia, the person starts having typical pain in the form of episodes of current-like sudden shooting pain. See, you have to remember that the intensity of this pain is
The identification.
unimaginable.
Okay.
It is bad.
Acha.
If you imagine the dental treatment, when
Mhm.
the drilling is going on, sometimes it touches the nerve and you get
And you
sharp
get a
pain.
Sharp pain. Yes.
So such is the kind of pain which these people get frequently.
Acha.
So when it starts with this, over the period of time, some people can progress to a stage where there will be continuous pain, okay, and on the background of that continuous pain, they will have these attacks of sudden increase in the pain.
Okay.
So this is called as type 2 or atypical kind of presentation of trigeminal neuralgia or type 2 trigeminal neuralgia. So type 1 converted into type 2, that's what we call.
Okay.
Rarely one can get directly atypical or type 2 type of pain,
Acha.
and that time you have to be very careful to differentiate, when you decide about the treatment. So clinically, it is a very important topic. When you examine a patient, you have to come to the conclusion after a lot of history taking and examination.
So what is the particular reason why this trigeminal neuralgia pain happens?
So there are 5 or 6 reasons
Okay.
for trigeminal neuralgia. But the commonest reason, which is applicable in, I would say, in about 98 to 99% of people in its classical form, is when a blood vessel presses on the trigeminal nerve and it causes damage of the trigeminal nerve because of continuous pulsations.
Acha.
And this happens inside the skull,
Acha.
where the nerve comes out of the brain,
Acha.
brainstem, and then travels ahead towards the skull and then comes out. So this portion where it just comes out of the brain, it is very crucial. It is very sensitive in some people.
Okay.
It is called as root entry zone or OR zone. So simply root entry zone, where the nerve enters into the brain. And this portion, this portion is very sensitive in some people genetically. On the top of that, if there is a blood vessel which is in the vicinity, and because of various reasons, I cannot go in too much depth because it becomes very technical.
Yes.
So in some people, these blood vessels go on deeply burrowing inside the root entry zone, and the pulsations start hitting the nerve.
Acha.
And this goes on increasing because the length of the blood vessel increases. And then the nerve becomes very sensitive, it starts firing,
Acha.
and the pain occurs.
So is vascular compression the only reason for trigeminal neuralgia?
No, I said this is the commonest reason.
Okay.
The other reasons are tumors
Acha.
or some neurological disorders like multiple sclerosis or some other rare neurological disorders can also cause this. But in its classical form, it is usually because of the nerve getting compressed by blood vessel, which we call as neurovascular conflict. So it's a conflict between nerve and blood vessel.
Okay. And is there any particular age group or gender bias of this trigeminal neuralgia?
Yeah, commonest age group wherein people get this is between 40 to 70.
Okay.
But the youngest person we have treated was 16 years old and the oldest person was 84 years old. So this is the range.
Acha.
The commonest age is between 40 and 70.
Okay. And why is this typical, more increased incidences post 40? And any specific reason?
No, that is because the length of the blood vessel as the age advances goes on increasing.
Oh.
If you have seen hands of elderly people, you will notice that the blood vessels are curvy because they are elongated. Similarly, in everyone, the blood vessel length goes on increasing. Okay. So in people who have neurovascular conflicts, also the blood vessel length goes on increasing. That is why around 40-45, the length becomes so long as to start causing the problem. And that is the reason why it appears in this age.
So once we know, I mean, once you know that it's a case of trigeminal neuralgia, what are the common diagnosis procedures we do?
See, the diagnosis, investigation that clinches the diagnosis, it's not an investigation, but it's a clinical examination or history.
Okay.
It is the most important thing.
The clinical history.
The clinical history. And it should be taken by the team who is dealing with trigeminal neuralgia repeatedly and such pain syndromes of face repeatedly. So you can differentiate between shades of different types of pain and come to the definite diagnosis of trigeminal neuralgia. Because the diagnosis has to be made properly to treat it properly. The second investigation that we order is MRI.
Which is a high resolution MRI.
High resolution MRI, but not only any MRI or not brain MRI. So the MRI that we order, it is a very specific type of MRI. And we order studies of the nerve portion where it is entering inside the brain, along with specific type of angiography and venography, because when we want to plan the surgery, we need to have a lot of information. So the MRI that we order for diagnosis and planning of trigeminal neuralgia is very specific.
Okay.
And it gives a lot of information.
So coming to the line of treatment, sir, though surgical intervention is always a major part of trigeminal neuralgia treatment, but we have also heard a lot about carbamazepine treatment, and does it actually help, or is it long lasting enough?
Yeah, see, if you come to the treatment of trigeminal neuralgia is treated by different methods. But we have to understand that barring one method, that is microvascular decompression surgery, all the methods are either temporary or they are just methods to temporarily stop the pain.
Okay.
Something like that. For example, the medicines which are given for trigeminal neuralgia are nerve numbing medicines.
Okay.
These medicines were first designed to prevent epilepsy.
Okay.
So to say, they are anti-epileptic medicines given for pain. Okay. So they numb the nerve. However, unfortunately, the medicines do not know that only that nerve has to be numb.
Correct.
So it numbs the entire nervous system.
Achha.
Along with that, it has got detrimental effects on liver, on bone marrow. It could have, detrimental effects on different body systems.
Yeah, including the, the regular urinary system and everything goes for it.
So yeah, a lot of systems get affected by chemicals that we ingest. And as this disease is a continuous disease, and with time its intensity goes on increasing, though its intensity in between can fluctuate. If you have to rely on medicines, you have to rely on these medicines for prolonged period of time, sometimes lifelong, and in increasing doses. So just to numb this pain, you are endangering your body with the chemicals for a prolonged period of time. Now, this is justifiable if there is no other treatment.
Correct.
Okay, and this was the case some years back
when
the surgery was not available, or the surgery that was available was not as safe, or there was no focus center of treatment like we have today, where one can deliver better results. Then perhaps it was justifiable, because there was no other way to treat this pain.
Correct.
But in today's era, people have to be educated that this pain needs to be cured for good, permanently. And not only that, you should be able to stop the medicines which are detrimental. Okay. And you have to understand one thing, that any pain syndrome that happens in the body, it creates changes in the brain structure, in body structure over the period of time. This is called as chronic pain syndrome. Okay. It has been proven that if person suffers from repeated pain of high intensity, though in between he's taking medicines and he is trying to subdue it, because of this pain facilitation, pain happening through the same pathway repeatedly, there is a brain structure change. And the person becomes sensitive to any kind of pain, more sensitive, because the sensory area of the brain, which subserves the function of understanding pain in the body, that expands in size.
Correct.
This is called as chronic pain syndrome, and we should not forget this phenomenon. It causes changes in the personality. It causes changes in the brain structure. It causes changes in pain sensitivity of the person, and the entire life starts revolving around this pain. So if you know this chain of events which are going to happen, which is going to happen, if you leave this pain untreated, then we will understand why timely surgery is so important.
So you must be seeing a lot of personality changes in the people
Sure,
who have
sure.
trigeminal neuralgia.
Absolutely. Because people do not know initially that this is trigeminal neuralgia in the first place. Many people who come to us, they have, tooth treated or nose treated. Some people have had their teeth extracted. Some people have had, psychiatric treatment
So they,
given to them.
they come to you quite late, I must say.
Many of them come quite late. And those who know that, this is trigeminal neuralgia, unfortunately, they are told that surgery is the last resort.
Acha.
Actually, it is not true.
Okay.
Because surgery has the capacity, if done early enough, to prevent the cascade of events, that is going to happen over the period of time, like personality change, brain change, taking medicines and chemicals affecting your organs. So this information, if they get this information in the right perspective, perhaps they would have come to us earlier.
So if they come earlier, then the line of treatment becomes much smoother and
Much smoother.
less complex.
Less complex, because
Yes.
you just treat the pain goes away,
Correct.
medicines stop,
Yes.
and it is done early enough so that, the further damage has not happened.
Yes. Sir. So what are the different options of treatment for trigeminal neuralgia? And also when it comes to surgery, what are the different surgical options available?
See, if you want to understand different options, you will have to remember the cause of trigeminal neuralgia. Okay. Now, as I told you, the cause is a blood vessel which is pressing on the nerve in about 98 to 99% of people, where the nerve is entering inside the brain. And what happens there exactly is that because of the pulsations, the covering around the nerves, it gets destroyed. If you imagine an electrical cable with, small wires inside them, and suppose you imagine that the wires coatings, the coating has given away, the wires will touch each other and there will be spark. Something like this happens where the blood vessel is pressing on the nerve. Now that is the cause of the nerve inside the skull where the nerve is entering, right? Either you are giving medicines, the medicines are trying to numb the nerves chemically, as I said before.
Correct.
The other option is to burn the nerve somewhere.
Burn the nerve.
Burn the part of the nerve.
Okay.
Don't treat
That sounds very
don't
scary.
treat no, just listen to me. Don't treat the basic cause, but burn the nerve somewhere distally, somewhere here. It can be done either by radiation, or it can be done by radio frequency waves, or previously it used to be done with chemicals like alcohol being applied to the part of the nerve called as ganglion. You understand? So we are trying to burn the nerve to numb it, rather than treating the cause of the pain from where the pain is originating.
So basically,
there are different methods in this, like radio frequency, like radiation therapy, or alcohol therapy, or there are some mechanical therapies in which they put a balloon around the nerve and they inflate the balloon. So pressure of the balloon numbs the nerve. Now, these are all good salvage procedures, but they cannot be mainstay procedures in trigeminal neuralgia. What I want to say here is that trigeminal neuralgia is not merely treating the pain. We want to treat the possibility of complete, we want to create. So what I want to say here is that trigeminal neuralgia treatment is not only about treating the pain. It is about preventing the future cascade that invariably happens if you do temporary treatments. And tampering with the nerve distally, where there is no compression, can cause, in some people, additional pain which is called as neuropathic pain. The pain recurs sometime or the other, and the recurrence is usually worse than the pain before. Now again, when the surgery was not there, or was not safe, or there was no center for surgery, these all were perhaps justified. But in our group's mind, in our philosophy, the way we look at this pain and people's lives with this pain, I think the first line of treatment should be microvascular decompression surgery with the aim of curing the pain. And preferably it should be done by a group which is doing this surgery repeatedly, because there are many pitfalls and nuances of this procedure. This is what we believe, and it has got a potential to give better results if the same team performs the surgery again and again.
So, sir, your team has so far performed more than 2,000 plus surgeries for trigeminal neuralgia. Share some memorable case with us.
Yeah, I have been asked this question before, and the case that I cannot forget
Okay.
is the case because of which we started this
Acha.
MVD surgery center in Pune.
Oh,
There is no dedicated microvascular decompression surgery center anywhere, to the best of my knowledge, in this part of the world.
okay.
But why we started it? A person came to me
Mhm.
21 years back, to be precise,
Okay.
and he was a very well educated engineer. I didn't know it at that point of time. When he came, he had a long beard, and he was looking really miserable. He was drunk also,
Okay.
and he came to me, he sat in front of me, and he said that I have this pain called as trigeminal neuralgia, and he was not able to speak like this. He said, I have this pain. He was not able to move his mouth. The trigeminal neuralgia, and if you can't treat it, I'm going to commit suicide. It was like a Hindi film kind of a thing that was unfolding, and he literally brought out a bottle of insecticide and kept it in front of me.
Oh my God, what are you saying?
It actually happened in our clinic,
Oh.
and he was, of course, he was in a very bad state.
Okay.
And then we told him that we are going to try our best. If you have trigeminal neuralgia, we are going to operate on you after doing MRI and proving it, etc. And we operated on him. He was cured of his pain. He was contemplating suicide seriously. And when he got cured, he told me that you have to do something about it. There are so many patients, because he had spoken to many doctors. He had met some patients also. He said there's so many people who are suffering. So you have to start something, in a very focused manner to cure trigeminal neuralgia. And that's when we started this MVD surgery center. So I can never forget this case. And it was an eye-opener that even in present era, where neurosurgery is advanced so much, people are not aware of many things.
So, sir, this MVD center which you are referring to right now, so of course you have been doing it for so long, even probably from a time when this awareness was also not there. I mean, to be honest, it is
Yeah.
not there now also. But then back then, so what kept you motivated to do this, and how come your focus was only on, you brought your focus on such a small thing?
So, when we started operating in a focused manner on trigeminal neuralgia, I realized that there is lack of knowledge not only amongst public, but in doctor fraternity.
Acha.
Because the way the disease was looked at, even by the doctors, they thought that surgery is the last resort. Trigeminal neuralgia is not, as I said, it is not only treatment of pain. Trigeminal neuralgia brings with it a continuous state of anxiety in the sufferer as to when I'm going to have the next attack. He is that constant dread. If you have heard this story of a tiger who is inside the cage, and there is a sheep which is kept outside the cage, just by the presence of tiger, the sheep dies in some time. This is a very famous story.
Yes.
So it is like this continuous dread that the pain will come.
And you never know when it will come.
So the person becomes, he starts suffering from anxiety, starts suffering from personality disorders, personality changes. And over the period of time, he starts suffering from chronic pain syndrome, as I explained before, becomes more sensitive to all sorts of pain in the life, and starts suffering from side effects of the medicines, starts suffering from social embarrassment, inability to mix up with people. So it is not only pain,
The list goes
it
long.
involves entire life.
Correct.
It finishes the life completely. And this aspect of this pain is not understood by the clinicians properly. They think it is just treatment of pain. No, it is not. The real treatment is to stop the pain and stop the medicines and stop the anxiety that I will have next attack.
When will I have the
This
next
is,
attack?
when will I have next?
Next attack.
This is the treatment of trigeminal neuralgia. And this has to be understood by the clinicians. So we started really working on that. And that kept us, really going. And we, started teaching people. We started creating patient support groups, and I started giving lectures in dental organizations and neurologist organizations. I cannot say that, I have been able to really take this message forward to the extent that I would like to, but we have made a lot of headway. And
So, sir,
we
I
are
just
still,
heard you mentioning about the patient support group.
Yeah.
Tell us more about it.
So patient support group is something which is very important.
Okay.
Person who has undergone treatment, especially surgical treatment, if such a group of people who have suffered from trigeminal neuralgia and they feel that other people should be helped, then they come together, they form a group, and they tell us that if you get any patient like us, we would like to speak to that person
Achha.
and tell that person how it has changed our life. Okay, our only insistence is that please don't recommend that they should take a particular decision, surgery, no surgery. Just tell your life story. But it is such a fantastic thing, and it gives a lot of confidence to the people that he or she can get out of this pain. This is the first step, and then coming to the decision of surgery, getting operated and getting cured is the next step.
So the trigeminal neuralgia, undoubtedly creates a lot of physical, emotional stress for the patient.
Correct.
But the collateral damage happens to the family as well.
Absolutely.
And the caregivers.
Absolutely.
So if, today's podcast, what message do you want to give out to those families and their dear ones who are suffering from trigeminal neuralgia? What message would you want
See,
to give?
one thing about trigeminal neuralgia you have to remember is that the pain comes suddenly, as I said. So it appears initially almost psychic, because person is nicely sitting and suddenly there is pain. So initially the family thinks, whether, there is some psychiatric problem or something like that. So they have to first understand that it is a physical problem. Second thing is that sometimes it is very traumatic for the family to look at a person suffering from the pain. I have had patients, teachers, who told me that, school teachers, that when I get an attack while teaching school children, they start crying. There's a gene of empathy in humans. So the people around also start getting affected. And I would like to tell them that you have to aim at cure. Again, it can be cured. It should be diagnosed in time, operated and cured in time. Get knowledge about this, get educated, and take steps. The times are different. Neurosurgery has advanced. We have a dedicated center in India. You can get information about that. We have put a lot of material of education on the internet.
So, sir, I've heard that people from overseas also come and see you
They do.
with regards to this. So, can you share some recent patients you have seen in the past?
Yeah, we have been operating, as I told you, for 21 years. And this lack of knowledge is not restricted only to India.
Okay.
Even in advanced countries, there is confusion still in minds of some clinicians because they are not exposed to the surgical excellence of the teams which are focused on this, because it's not a very common disease. That is the reason. So we have operated patients coming from even advanced countries like US, from Canada, from Australia and UK, along with other countries like Middle East, from Oman, from Dubai we have operated, from Africa, and of course from almost all the states of India we have operated these patients. And I'm extremely happy that we have been able to make many of them pain-free. Any surgery has got success rate in percentage. And when we started this, our success rate was in the range of 97%.
Wow.
I'm very happy that now we have success rate of 99% because we have been doing this surgery repeatedly. Of course, we advise everyone to study the surgery risks also, because any surgery, like medicines, could have risks. So, it's a rational decision. We discuss all the points with the patient and let them finally take the decision. But I'm very confident that anyone who is suffering from such severe pain would like to really get rid of the pain permanently.
And I'm very confident that today's discussion would have brought in so much of light for so many people. Thank you, sir. Thank you once again for coming for today's podcast. And we would definitely want to see you again for another round of discussion on some more interesting topics.
Thank you.
Thank you so much, sir.
Nice to talk to you.
Thank you
again.
Thank you.